Welcome to the Doctor's Dictionary, an episode on sexual and menstrual health. Today we have a mother-daughter duo to answer our questions related to this subject, and they will be bursting a lot of myths regarding it. First on, we have Dr. Neena Moses, an obstetrician and gynecologist having about 45 years of experience. She has done over 40,000 deliveries up till now and is keen on having normal delivery. She is very disciplined and still continues delivering babies. So doctor, let's talk about menstruation. So my first question will be, what is menstrual health?
It's a state of complete physical, mental as well as social well-being related to the periods. There should not be, a period should come and go without putting any stress on a woman's health.
Doctor, what's menstruation?
Normal vaginal bleeding which takes place as a woman's monthly cycle, which is indicative of shedding of the inner lining membrane of the uterus. Each month, a lining membrane forms inside the uterus, and at the end of the cycle, it sheds. Someone wrote that it is the weeping of the uterus because it has been preparing itself for a pregnancy. A pregnancy does not take place and therefore it bleeds, and you can call it weeping of the uterus.
And what's a menstrual cycle?
A menstrual cycle begins on day 1 of a period until day 1 of the next period. So the period between two periods is called a menstrual cycle. Generally, it is of 28 days. It may vary from 25 to 35 days. Many women think that they should have bleeding on the dot, same date each month, but that generally never happens. There is always some variation of 2-3 days or 4-5 days, and that is considered to be normal.
Doctor, when does it start and stop for people? Is it like different for different people, or it's like one common generic thing?
The starting of menses in a woman's life is called menarche, and it takes place anywhere between 10 to 16 years, 12.4 years being the average. The cessation of menses is called menopause. That happens anywhere between 45 to 55 years.
So doctor, my another question would be, what can you use during those days of the month?
What a woman uses during those days depends on her own choice. She may use sanitary napkins, she may use tampons, or she may go for cups, which is a recent craze, I may say. The younger generation, quite a few ladies like to use cups.
And what can be the normal symptoms of menstruation?
A period may or may not be associated with any symptoms or any problems whatsoever. But some women tend to experience bloatedness, breast pain, diarrhea, vomiting, nausea, and abdominal cramps.
Ma'am, what sort of preparation should be done before those days of the month?
Stock up on your period products, your painkillers. Continue your exercises as you are doing them. Maybe you can make them little gentler. Trimming of pubic hair and nails should be mandatory.
Doctor, what affects our menstrual cycle?
Gaining or losing weight affects your periods. Any kind of stress can affect your periods. It can be in the form of change of place, exams, marriage. All these things which lead to stress in a woman's life can affect the periods. Change in routine exercises that she has been doing, if she increases those suddenly, that can affect the periods. And then there are certain diseases like PCOS and thyroid disorders which can affect the periods and disturb the cycles.
Doctor, what are delaying pills? Should one use them actually?
A woman may want to delay her periods on special occasions in her life. It can be for wedding, it can be for traveling. She can delay the periods, but it should not become a habit. There are hormonal pills which a doctor can prescribe. Those are supposed to be taken about at least 5 days prior to the expected date of periods. And after the event is over, the tablets can be stopped. A few side effects like breast tenderness, headache, nausea may be there with the pills, but nothing much to write home about.
Doctor, what are the do's and don'ts which one should keep in mind during their periods?
Do's and don'ts during your periods. I don't think there is much to it, but it is believed that avoiding coffee, that is caffeinated drinks, avoiding salt helps. Exercising, yoga also help.
Doctor, please help us understand the term endometriosis.
It's a condition arising out of deposition of endometrial tissue outside the uterus. As we all know, the rightful place of the endometrium is within the uterine cavity, and the function of endometrium is to bleed. So when endometrial tissue goes and deposits itself outside the uterus, it tends to bleed when a woman is having menstruation, and that leads to a lot of problems. That leads to severe pain during periods. It can lead to heavy bleeding during periods. It can lead to a woman becoming infertile.
Doctor, how can one maintain their vulva hygiene?
Maintaining vulval hygiene is very essential to avoid infections and irritation to the vulva. Simple things like cleaning the vulva at least once in a day with gentle soap and water, wearing loose underwear which are comfortable to wear, trimming of pubic hair before periods, avoid using harsh soaps, deodorants, scrubs, etc. on the vulva. Make sure you use gentle soap when you want to clean the vulva.
Doctor, this is my final question to you. Help us understand the term PMS. The youngsters these days are using it very casually. So instead of becoming a medical term, it has become a millennial lingo. So what is PMS?
PMS, that is premenstrual syndrome, refers to changes in the mood, in the emotions, in the physical health, and the behavior of a woman prior to her periods, beginning a week to 2 weeks before her periods. It may have a variety of symptoms. There may be mood swings, there may be feeling of bloatedness, there may be irritability, there may be feeling of depression, aches, pains, food cravings, etc. Minor, mild symptoms or 1 to 2 symptoms would be experienced by most of the women. but there would be some women who would be affected to such a degree that it impacts their daily routine, it impacts their family members as well. And those are the women who should seek the help of a health professional.
Thank you so much, Dr. Neena, for sharing your valuable knowledge with us, highlighting and guiding each of the viewer, the youth especially who are watching us today through this interview series about the menstrual health. Thank you once again.
Thanks, Nikita. It was nice being here. Thank you for having me here on your show of Doctor's Dictionary. Thanks a lot.